My name is Suravita Ghosh and I am a dental assistant by profession and working in Canada for the past 2 years as a dental assistant. I kept working during this pandemic, we worked with extra protection, of course, but I was still anxious to get the vaccine because I felt that protection of my family, any other people whom I know or I don't know, I'm meeting in public places or in other places. I wanted their protection also, so I felt that vaccination for me is very much important. I never had any reservation regarding these vaccines that has been introduced because I felt that it has been introduced by the consent and hard work of many expert people around the world, and it has been introduced for the welfare of the entire human race all over the world. So yes, I was waiting for this vaccine. Of course, I did some research before I was vaccinated, and I kept on listening to the updates that came in the news regarding the development of each vaccine, how effective they are, and what is the technology being adopted for developing them. I was excited to know a new technology, that is introduction of mRNA in the vaccine, has come up, which has been in process for many years, and because of this pandemic they actually accelerated the time for developing it, and it has come in now finally. Yes, and finally I was vaccinated, and in the privileged category, being a healthcare worker, I got vaccination on 13th of March, and a very important day in my life. And I felt privileged that yes, working hard and working for human being in this tough time actually paid me back, giving me vaccination. The procedure was very simple. The booking for appointments for getting the vaccine was absolutely online. Yes, I had to take an attestation from my doctor whom I work with, and he was very happy to give me that attestation of my employment, and that has to be carried with me to the hospital where I received my vaccine. And the procedure was not very complicated. Like you go, there was a small lineup, and then they call you inside and they take your temperature, and then they screen you, and you need to submit a scanning a code, and they see the color of the screening. If it is green, you're good to go, and you just straight away walk in, and they will put you in a cubicle with a nurse, and the nurse asks you several questions, which I won't be quoting here because it has to be quoted by them, and it has to be asked by a professional to anybody who is coming for vaccination. So if anybody likes to know that what we should know about ourselves before going for a vaccine, there are a lot of online resources which you can go to. If you can go to your regional healthcare, if you belong to Peel region, go to Peel Public Health, or maybe Toronto Public Health, any website, and you can read through what you should know about yourself, and those are the guidelines to decide whether you're going to go for the vaccination or not. After you receive your vaccine, you are asked to sit for 15 minutes. In some region, they're asking to sit for half an hour. Half an hour is the maximum that I heard. And you need to sit for that time and monitor yourself. If you don't feel any symptom or anything uncomfortable, you're good to go. After that, they are going to give you a receipt that you have received the vaccination, and they will also book you for your second dose appointment right away. So the experience was absolutely fine, and I was feeling fine after the first dose. So I'm eagerly waiting for the second dose, which I have been scheduled for after 3 months. So I will say, when your turn comes, get vaccinated and protect yourself.